that, though, I really believe that everyone, according to the Holy Scriptures, is fearfully and wonderfully made. And I feel like, everybody is made in God's image and is beautiful in their own way. And really losing weight, it's not about beauty. It's not about trying to, fit into the mold of the world. It's not about being thin, but it's really about being healthy, about living a long, healthy life, about feeling well and being able to do the things that we want to do and that we need to do. So I went ahead and just wrote out a few things about benefits of losing weight. There are so many, and you guys know these already, but I like to just go through them quickly and just to remember, because it is, in my experience, it's a lot easier to gain weight than lose weight. So I think on our journey, we want to remind ourselves of why we're doing it and some of the real benefits of losing weight. And you don't have to lose lots and lots of weight to experience some of these benefits. So we want to be reminded what's happening, why we're on this journey. So healthier joints, improved mobility, that's a big one. We want to be able to do what we want to do when we want to do it. We want to lower our risk of cancer. There's some good evidence that losing weight can lower our risk of some cancers, and none of us wants to deal with cancer if we can help it. We know that losing weight can prevent or improve type 2 diabetes. Actually, some people are able to completely reverse type 2 diabetes. So that's a very exciting benefit of losing weight. We also find that losing weight can cause an increase in the HDL, good cholesterol, which is extremely important. We can lower our triglycerides. We can lower our blood pressure. We can lower our risk of heart disease and stroke. We can improve our sleep. If we have sleep apnea, that can be improved by losing weight. We can have better mental health. We can have more joy, better self-esteem, and more energy. And who doesn't want more energy? I would love to have the kind of energy that my grandkids have. I'm seeing some people say they can't hear, so I just turned up the volume. Did that help any?
I think it did. They're saying they can hear now.
Okay, good. Okay. So I have a couple of quotes from some medical journals. We won't spend a lot of time on medical journals, but I did find a couple of interesting quotes I'd like to share with you guys. I like this one. Bariatric surgery is the only current weight loss intervention that reproducibly results in diabetes remission, which in turn could result in subsequent reductions in cancer, cardiovascular disease, and premature mortality. So that's great news. And then one more. Cohort studies show that bariatric surgery reduces all-cause mortality or death from any cause at all by 30% to 50% at 7 to 15 years post-surgery, compared with patients with obesity who did not have surgery. So this is great news as well. This is my husband, Randy, and I'm sharing this with his permission. We've been married almost 34 years, and this picture is probably from Christmas of 2016. He's always been a big guy. When he was born, he weighed 11 pounds and 8 ounces. I'm pretty sure his mom had diabetes. Back then, they may not have screened for diabetes and treated as aggressively as we do now, but he came into the world a big guy, and he's always been a big guy. He played football in college, but 2017, he decided on his own he wanted to have the sleeve. And so October of 2017, he had the sleeve, and he did very, very well. And I'm going to show you guys a picture or two of after. This is Randy after his surgery. And then one more picture. And this is us at one of our quote races. So I want to share Randy's story. Of course, I was there to help him all along the way, but he did very, very well. Has he done everything completely right? No. And he said it was okay if I tell you what I tell him when he does wrong. I threatened to tell Dr. Pinson, and I threatened to tell Ginger, but that doesn't really affect him too much. But he's done very well. He has kept the weight off, and he's diabetic. He's still diabetic, but his diabetes is much improved. Instead of taking 75 units of insulin every night, he gets about 16 units. His sugar is well controlled. He has sleep apnea still, but it's better. He has a bad left knee from playing football, but taking all that weight off of that knee has greatly improved his knee, and he's able to do really what he wants to do, which typically does not include the honey-do list, if you guys and ladies know what I mean. But I wanted to talk for just a minute about exercise. You can see this is a picture from a quote race, and I put that in quotes because when I started hearing about races, I thought, well, that sounds interesting, but I can't run. I mean, I can't run very fast. You know, I can walk fast and I can run some, but I want to encourage you guys, if you've not tried it, sign up for like a 5K. And once you've done that, then you could advance to a 10K. My daughter and I have done a half marathon so far, and I made it fine, but I can tell you my feet were hurting by the time it was over. But Randy, even with his bad knee, since he's lost weight, he can do these quote races. And really, you don't have to run. You don't even have to walk fast. One of the races I did, there was a guy that I know he had COPD. You could hear every breath, but I was so proud of him because he was out there doing the best he could. And it's really fun because you can do this with someone else. So I really feel like to lose weight and keep it off, definitely follow the instructions that are given us by the Bariatric Center. And one big thing is the exercise. And I just want to say exercise is just critical to good health, not just weight loss, but overall good health. And I wanted to tell you guys that bookworms can learn to love exercise. And I'm talking about myself because in my life, I've really loved books, and I've been going to school for a long time. I did play basketball in the 7th grade, not very successfully, I'll say. I wasn't very good at it, but I've learned to love exercise. And, even couch potatoes can learn to love exercise, and it helps us to be healthy. Even a few minutes of exercise a day makes such a difference. So I wanted to spend just a few minutes talking about exercise. And I found this quote from Dr. Rady, who's actually a professor at Harvard. And he said, exercise is the single best thing you can do for your brain in terms of mood, memory, and learning. And he said, even 10 minutes of activity changes your brain. So that's great news. We're all busy and we feel like we don't have time. And, where am I going to find the time for exercise? But we can do it. If we're committed to it, we can do it. I wrote out a few tips. These are some things that have helped me, and I think some of my patients. I think we shouldn't ask ourselves, like right now, if I have a few minutes, I shouldn't ask myself if I feel like it. Just go ahead and do it. And I say schedule it. Go ahead and build it into your day. If you've not been doing it, get permission from your provider to do it. And, gradually increase your exercise as you tolerate it. And I want you to get to the point where you love it and you feel cheated if you miss it. And you can definitely do that. And the overall goal for all of us now is at least 30 minutes every day of the week. And if we aim for every day, we're hoping we get 5 days per week. So that's 150 minutes of exercise per week. And I want to encourage you to choose things that you enjoy, things that you'll look forward to. If you don't get to loving it, you won't keep doing it likely. So really think about what would you enjoy doing and do it. And I want to encourage you to have a backup plan. So many times when I'm talking with a patient and, about exercise, we're also human. I hear it's too hot, it's too cold, it's too this, it's too that. So let's don't make any excuses. Let's make a commitment to exercise. If it's okay with our provider, let's go ahead and make a commitment to do it. I'm telling you, the rewards are just amazing. I want to encourage you to get a buddy to exercise with, somebody in your household maybe, now that we have to wear masks with outsiders, or you're going to be outside. So if you're distanced, you can have your exercise buddy or buddies with you. I'm hearing from patients that some of the gyms are really doing a great job with cleaning, and so they feel comfortable to go back to the gym. Be careful. I hope you're vaccinated. If you get sick, get the monoclonal antibodies, stay well. But let's exercise. Let's make it a priority. We want to get healthier for our immune system right now. So use a tracker. My Apple Watch really is a good motivator for me because it reminds me to get up periodically. And, it's going to remind me I need to get my steps in. The overall goal for all of us is 10,000 steps per day. And again, if you've not been doing it, I encourage you to gradually get to that, and you'll be so proud of yourself. But just any kind of tracker, it could be an inexpensive tracker, but that way you'll be able to keep up with what you're doing. And if you're kind of lagging behind, get some more steps in before the end of the day. Walking is great exercise. If your joints are already a problem, the aquatic center or the wellness center for the swimming pool, there's just so many different things you can do. I have a patient that loves pickleball. There's lots of options. So I want to encourage you to get involved in some kind of exercise, and maybe multiple types of exercise that you really enjoy that'll help you to become healthier and stay healthier for the rest of your life. And I want to encourage you to fall in love with water drinking. Now, Randy, my husband, he does not love water yet. But I wish he did, because it's so good for us. It's so important for so many reasons. I want to encourage you to hydrate before, during, and after exercise. I don't want you to drink much water or drink much fluids with your meals, but in between meals, and first thing when you get up in the morning, start drinking some water, and in between your meals, drink a lot of water. And a lot of times when maybe we've had our meal and then a little bit later we start to feel a little hungry, we're probably just getting a little dehydrated. So a lot of times a nice glass of water is exactly what we need, and then we'll make it to our next meal. So in closing, I just want to say that you guys are totally worth it. You can do this. And in general, I think all of the primary care doctors are supportive. We certainly want to be partners in this because we really care about our patients. We want to do anything we can to help our patients to get healthy and stay healthy. And so in my opinion, bariatric surgery is a great option for so many people. And I'm so thankful for the program that we have here, for Vivian and the team at the Bariatric Center. So thank you guys for listening, and thank you, Vivian, for inviting me. And if there are any questions, I'll try to answer those.
Okay. And thank you, Dr. Bassler, for agreeing to do this. All right. So I'm going to see if you have some questions.
Okay.
All right. If anyone has questions, you can type it in the chat box and she'll be able to answer them.
Yeah, I saw that one about drinking too much at meals. And Vivian, you all talk about that, don't you? We don't want to drink too much with our meal because we won't be able to get our protein in, right?
Correct. We don't want them to drink with their meals. They will stop 15 minutes prior and resume 30 minutes after a meal.
Yes, that's great.
And one says that her knees hurt and hopes that the surgery will help with her knee pain. And she's asking, will it?
Yes, well, I can definitely tell you from my husband's experience. As I said, he had a bad knee. His left knee was bad from football, and he had already had some arthroscopic surgery on it. And so when he lost all that weight, there's an amazing difference in his knee. And he really, I think he notices, and I think Dr. Pinson had talked to him about it. Now, like if he picks up something really heavy, and you can imagine if you pick up something heavy, you can kind of feel what it felt like before when you were carrying the extra weight. So I'm telling you, it's really made a big difference in that bad knee that he had. And the orthopedic surgeons tell us that like for every pound we lose, there's so much pressure taken off the joint. So it's definitely the right thing to do for our joints.
Okay. Any more questions?
Yes, wish you all the best. Yeah, yeah, and the diabetic, I saw that question about diabetes, and it really varies from person to person, but type 2 diabetes, most people that have type 2 diabetes, at least early on, their body is still making insulin, but it's resistant to the effects of insulin. So many type 2 diabetics that are carrying extra weight have to take a lot of medications. And it is amazing to me to see the effect of the bariatric surgery and the weight loss on that. How a lot of people are able to get off medications fairly quickly because that extra weight is causing, what we call insulin resistance. So, we can't say for sure how quickly that will happen, but for many people, it's a fairly rapid thing. Um, some people, if they just lose 5 to 10% of their body weight, their sugar can normalize or come close to normal. So that's great news. You're very welcome. Thank you for your questions. And I will say you don't have to be a perfect patient to do well. Now, I will encourage you to follow Vivian's instructions, the team's instructions to the letter. And anyone that's seen me as a physician, I talk about my husband all the time with his permission because he is not the world's best patient. In some ways, he's a bad patient, but of course, I try to keep him in line. But doing your best, I mean, doing your very best and constantly trying to do better really pays off. And so he has found that um, you know, try to do as best you can what you're told to do, and there's many rewards for that and for the weight loss that you achieve. What was that last question, Vivian?
The last one they wanted to know was how many calories should they have with each meal?
Ah, okay. Yeah, and I'm going to leave that to you, Vivian. I'm not sure if you guys are doing calories. I thought we were still doing the protein. Are we still doing the 60
Yes,
grams of protein? Okay. I'll let you take that one,
correct.
Vivian.
We are doing 60 grams of protein, so you really don't need to worry about the calories. You need to worry about how many grams of protein. You should never have more grams of carbs than protein. So you need the largest amount of protein in each meal that you can tolerate, and eat your protein first, your vegetables, and then your carbs. So you don't need to worry about counting calories, because if you're getting high protein, low carb, you're not going to have very many calories to really worry about that being a problem.
And that's wonderful. Isn't that nice not to have to count calories? I think that's a great benefit of it.
All right. And another question is, a patient get injections in their back, and wanted to know, will they still need those injections after surgery?
Yeah, that's a great question, and we pray that you won't need those. We can't say for sure, but there's a hope. There's a hope that that can be stopped. Um, it does, weight affects so many things. So we pray that that'll be your case, but we just can't say for sure. But we certainly hope that'll be the case for you.
And also, if the injections contain steroids, then you need to stop that 30 days prior to your surgery, and you will not be able to resume that until 3 months after your surgery. And they wanted to know what labs should they ask for when they see their primary care provider 3 months post-op, which of course we usually do the labs at 1 year.
Right,
And
and
we
that's
usually put the panel in, and when they go to
yes.
their PCP, if it's within the system, then the PCP will put the labs in under their name.
Yes, yes. So the bariatric clinic has that really, their bariatric clinic has a wonderful protocol for these things. And of course, family doctors will talk with you. And if there's, questions you have about the labs, they'll go over those. But yeah, I think if if you stick with Vivian and the team, you'll be okay on that lab work.
And then, of course, if you start having some symptoms and we need to do that earlier, then of course we could do it earlier. All right, and supplements, we do ask that you take a multivitamin with iron, not a gummy, because the gummies are not dissolved well and they do not contain iron. So you need a regular multivitamin after you can swallow your pills whole if you choose to, but prior to that is usually 2 children's Flintstones with iron or Flintstone complete.
Hey, Vivian, back to that question about the lab work too. Some of the patients are seeing us, maybe 3 months out because they have diabetes, or they're
Yes.
seeing us because they have high blood pressure or high cholesterol or something like that. So it will still be labs like that, like we normally do when you come see your doctor for that.
Yes, correct. All right, and for the shots, the injections in your knees, it'll be the same way as the back. If it contains steroids, you would have to stop 30 days prior and you couldn't resume until 3 months after the surgery. Someone wants to know if your neuropathy would get better with the weight loss.
Is there neuropathy from diabetes?
Let's see if she's gonna answer back.
Okay.
Yes.
Yes. There's a lot of hope for that, because one of the first things, if one of my patients has diabetes and they have neuropathy, losing weight and lowering the blood sugar is the first thing I want them to do to try to get relief from the neuropathy. So there's a good chance.
Okay. Um, one of the patients said that they have to take Enbrel for it's a shot that they do on a regular basis, and wanted to know would you need to stop that. Well, you would need to stop anything that would contain aspirin, anti-inflammatory, steroid, or biologic, anything that would suppress your immune system. You would have to stop that 30 days prior and resume 3 months after. NSAIDs are not allowed 14 days prior to the surgery and for 3 months after the surgery. So if you're taking anything that's an anti-inflammatory for rheumatoid or just for joint pain, things like that, including over the counter, you couldn't have a Toradol injection or Toradol by mouth. Also, people who suffer with gout, I do know that you usually take things anti-inflammatory, and sometimes they may, with acute flare, do colchicine or steroids. Those type medications are not authorized right when you are in that early postoperative phase, because the aspirin could make you bleed, and of course, steroids suppress your immune system, and it makes the tissue more friable. All right, and want to know if people with epilepsy have different side effects from the surgery.
Do you know that one, Vivian? I'm not aware of any studies particularly relating to epilepsy and bariatric surgery. Are you?
No, ma'am. And we've performed surgery on patients who have a diagnosis of epilepsy. The only thing that I would say that may be of some concern, of course, the medication. Sometimes the pills are very large and they can't be crushed or open. So it can be changed to something different, but some of the newer meds, the size of the pill, and it can't be crushed or open. So it just may be the type of medication that they're being treated with. May have to speak with the neurologist about maybe changing something up for that purpose until after the 3 month period. But I don't know of any studies out there that says that it's something as far as different side effects. All right, so I wanted to know what percentage, as far as people who are successful with this surgery, and really and truly, It is exactly like, and at the end of the question, they wanted to know if it just depended on the person. Yes, it does depend on the person. If you had the way I feel about it, it's like a puzzle. If you looked at it that way, the surgery is 25%, you're 75%. So as a patient, if you do not work the program and utilize that tool, you don't get the results you want or the results you expected. So just having the surgery alone and not utilizing that tool is not going to get you where you need to be. So you're supposed to be changing things, the way you eat, your exercise, incorporating things that's more healthier, not continuing as you're doing or the bad habits, but because you had the surgery, then that means that you're still going to lose weight because you had the surgery. That's not the way it works, unfortunately. I wish it was something out there like that. It was just that easy. But you have to change your habits. So it all depends on the person. It depends on getting your protein in. It depends on your exercise. And it depends on not grazing, eating on things all day long. Like Dr. Bassler said, a lot of times if you just drink some water, that'll help. And for like the Ultram, that is not an anti-inflammatory, so that you could take. Any more questions? You have any more on your end, Dr. Bassler?
Did you just see one come across?
How long does it take to heal? Well, in 6 weeks, which you'll come back to the office for your 2-week post-op return, and you'll come back in a month after that. That's your 6-week appointment. You're released back to full duty at 6 weeks because you can go back earlier than that depending on the type of work you do. But if you have a job that requires a lot of pulling, tugging, lifting over 10 pounds, then you'll be out for 6 weeks. And you're released back to full duty after that. Now, the inside, as far as that sleeve, is not completely healed, but is at a point to where you can resume normal activity. All right, so yes, you could go, well, not after a week. Some people, I think, kind of rush it. If you have a desk job, you have surgery on a Tuesday, and you go back to work on a Monday or a Tuesday. First of all, you need to get acclimated to the new changes. And it's very overwhelming once you have the surgery trying to get everything in. So if you go back to work, you get involved in work, then you're not going to be able to concentrate on getting your liquids in, getting your protein in, and doing everything you need to do to build your body up to get you in a position where it's time for you to go back to work in 2 or 3 weeks. So a week is a little bit too fast. You can drive as long as you haven't had pain medicine for 24 hours, but of course you can't drive home from the hospital. But after you get home and just say you haven't had pain medicine since that Wednesday when you were in the hospital, then yes, that would be fine. Now, as far as setting times when you can eat, well, for the first 4 weeks, you're basically on a full liquid diet. So when you're able to actually chew something, you're going to see the dietitian at your 2 week and at your 6 week, and she's here full time. So you're able to see her or give her a call if you have questions, but she's going to go over with you a diet plan and you're going to go in stages. So she'll be there to guide you throughout those stages. Does the weight loss show up in a couple of weeks? Yes. I mean, you can lose weight on your pre-surgery diet. And when you come back in a couple of weeks, you will have lost more weight. It just kind of varies. Of course, men do better than females. Um, I would say an average with female patients is probably in that second week period. I would say anywhere from 10 to 15 pounds. And with males, you can see anywhere from 15 to 30 pounds in that 2 week period. All righty. All right. I think that answered the question about how long I'm assuming will it take to see results. So, and the thing is, you didn't gain the weight overnight. You're not going to lose the weight overnight. You need to really think about if you focus on changing your habits, following the rules, doing what the dietitian and the surgeon asks you to do, things will start moving along. You're, as a patient, just personally, this is just coming from me. I feel like it's kind of hard after you're a patient and you look in the mirror and you know that you've lost 50 or 60 pounds. You know that from your clothes and the scale. But when you look in the mirror, you tend to see your imperfections and what you need to fix. But everyone else see, oh my God, you lost so much weight. And that's something that you just have to get, your mind has to catch up with the part that we took away. So it's just kind of hard to get, take all of that in. But if you follow the rules, you don't have to worry about rushing it. You will lose the weight. Any more questions? All right, as far as getting pregnant, we do ask that you wait at least 18 months after you've had the surgery, a year to 18 months before you um, start trying to get pregnant. If your weight loss is not stable and you're in the early postoperative phase and you're losing a lot of weight every month, that could become a problem if you get pregnant. So you want to try to wait at least a year to 18 months before you do that. Um, we have a person who's a diabetic and on several medications wanting to know, is it possible to get off of some of that medication?
Yes, and that's one of the big benefits. That's what we were saying earlier. As you lose weight, that insulin resistance usually gets better. So type 2 diabetes responds very nicely to weight loss.
And the surprising thing about it is sometimes they come to the hospital and they may be on an oil and an injectable, and they'll leave the hospital on nothing
That's
and
amazing.
do well with just,
Yes,
watching their, still checking their blood sugars and following the diet plan.
yes. Even before they've lost a lot of weight, their body is already changing for the good.
Right. Any more questions? Well, I really appreciate you doing this, Dr. Bassler, and we enjoyed it and hope that you join us again.
Thank you, Vivian. I appreciate it. Thanks, everybody, and wish you all very, very best.
All right. Well, everyone have a blessed night.
Thanks. Bye-bye.
Bye bye.